Welcome to all. I am Dr. Chakradhar, consultant neurologist at Renova Nilima Hospital, Sanat Nagar. Today we will discuss about seizures, which is the most common symptom and presentation, particularly in the pediatric age group. However, even adults can also be affected. Now let us know a few things about this seizure. What is seizures is? It is nothing but because of sudden alteration in the activity of the neurons within the brain will result in certain manifestations or symptoms. This we call it as seizures. Now, what are the common reasons why a person will be developing seizures? Most of the time, usually these are unknown causes, and but among the known causes, most of the time it is the some insult or to the brain. This can happen from the injury, that is in case of accidents. When one sustains head injury, there can be an head brain injury resulting that can in long term can result in a seizure. Sometimes who has suffered a stroke can also have a seizure, and several other simple causes like abnormalities in the glucose levels or sudden increase in the blood pressures also can lead to the seizures. However, in pediatric age group and other age groups, there can be several other different causes such as malformations as well as some genetic causes can also be the reason for the refractory seizures. Here our talk mainly is to understand the preventable causes of the seizures and thereby for general health well-being of the population, what are the measures that one need to take during a seizure and how to prevent the seizure risk factors. So there are ones how to identify seizure. It is usually common type is generalized tonic-clonic one, what we see in general community, that is patient becomes unconscious and suddenly vigorously starts shaking the hands, legs and frothing. Most probably most of them might have witnessed this. However, this is the most common. There are several other causes of manifestations of seizures, that is only staring look or just blinking of the eyes and the deviation of the eyes could be a manifestation, or lip smacking movements and uh, cycling movements, or without any motor manifestations. There can be only the sensory manifestations, or which we call as auras, or only the patient can experience. The outsider person cannot visualize these symptoms. So this be generally these are the ways how the seizure presents. Now, what one should do when someone is having a seizure? What is GTCS? That is what on the roadside or in the home, when you witness a person is having a seizure, just go near him, provide the support so that he should not fall, and make him lie down on the surface, and make sure that there are no any sharp objects that the person who is having the seizure can hit during the shaking and suffers injury. And preferably make him to lie down on one lateral side, that is right side or left side, and do not put anything in the mouth, because most of the time we see that to avoid the tongue biting and all, the people will be putting various kind of things into the mouth. So avoid doing that, and there is no evidence of putting any metal object or any keys in the hand. That will not that did not work, or scientifically it is not recommended to do it. Just automatically the seizure subsides in about 30 seconds to a minute automatically, and then the patient can be shifted to the nearby hospital. And this is the most common type, but only the emergency is when this kind of seizures continues to more than 5 minutes or so, he has to be rushed to the hospital. And as a social aspect, what are the causes, sir? Mostly the road traffic accidents causing the injury to the brain, and CVAs, strokes are the common causes. So for prevention, what one should do is, once a patient is having the seizures and diagnosed to have the seizure disorder, if he is taking any medication, try to take them regularly and avoid stressors, because these are the two main causes of recurrence of seizures. And to avoid the chances of head injury, wear an helmet while driving, which is most important to avoid the head injuries, thereby preventing the seizures. With this, I thank you all. Please like, share, subscribe Health Focus All channel.